This is going to be a quick review of Chapter 20 and the developing person through the lifespan. Chapter 20 is about adulthood biosocial development. The first thing I would like to ask you as a class is to try to ignore the first story about Judy. Anytime an author in the end of the chapter has to say, I'm not saying this because I'm racist, you should really think carefully about what you're reading. So I would say disregard what was in the chapter. I understand it was a realistic story about an encounter with a student, but I think sometimes when we choose some of the things we choose, even though they turn out good in the end, and we relay things that seem somewhat negative about an individual, we need to think carefully with all the amazingly positive things about the experience of adulthood and all the just phenomenal amount of development that continues to happen in adulthood, the positive decisions you will make in your lifetime as an adult. I think that there are better cases that could have been chosen. Most of us will feel younger than we are as we age. Senescence is the aging process, and it's largely genetically coded. How you age is hugely determined by the genes you inherited from your parents. Now, of course, that's not the only thing that impacts the way you age. We know that one of the things we hope ages really well as we get older is our brain. But like every other body part, it slows down a little bit. It takes us a little bit longer to translate the messages we are hearing in our head or to learn new things. Your textbook mentions some biological factors that can cause severe brain loss before the age of 65. So these are the things that are not related to your genetics, but the things that either happen to you or you do yourself. Obviously, drug abuse, any psychoactive drug, including alcohol, can cause great harm to your brain. And any time you're drinking, even in moderation, it obviously has an impact on brain cells. But for those people that drink to excess and have abuse, they can have something called Wernicke syndrome, which is basically the B1 is depleted. And this is really common. Well, it's not really common, but it happens in those people who have long-term alcohol abuse. Obviously, poor circulation inhibits the health of your brain. And there are many things that can cause poor circulation, such as hypertension and cigarette smoking, to mention a few. But there are other things that you can do that will improve your circulation. So a well-balanced diet, a low-fat diet, obviously aerobic exercise is always helpful to circulation. There are viruses that can cross the blood-brain barrier, and this is a barrier that generally protects your brain, and there are many things that do not cross that protective barrier, but there are some, including HIV, which can cause severe brain disease over time. And then, of course, there's a traumatic brain injury, and most of us hear about traumatic brain injuries from things like combat injuries in the military, the repeated concussions of athletes, and other causes of traumatic brain injury might be a severe blow, like in a motorcycle accident. When I was young and in nursing school, at my pathophysiology teacher, Dale Goodfellow told us, if you're riding a motorcycle, you're nothing but a brain and a spinal cord, a brain and a spinal cord. And she was trying to make the point that it really is critical for people on a motorcycle to wear a helmet because it has some protective measures for the brain. It does nothing for the spinal cord. That being said, there are many types of other traumatic brain injury. We've all heard about shaken baby syndrome. We know that boxers can have traumatic brain injuries, but anything that causes a sudden injury to the brain is significant. And then, of course, one of the things that is really significant to us as we age is our outward appearance. And I know a lot of us would like to think that as we get older, our vanity decreases, but in reality, that's probably not true. And it is harder as we get older because there are things that we know. For example, we know that our skin and our hair starts changing, and significantly after the age of 30. Our hair gets thinner, our skin gets thinner, and we lose part of the fat and the connective tissue under the skin, and then we start seeing wrinkles. And they usually first appear around the eyes, and we do all these amazing things and spend a lot of money on creams and lotions and so forth to fight the inevitable, which is we will get older and we will have wrinkles, and our hair will get thinner. And hair thins on both men and women. A common misperception that women don't have hair thinning. They do. It's the pattern of the thinning that is generally different. Men have what's called male pattern baldness, either right on the crown of their head or going backwards from the temples, whereas women have generalized thinning all over. It is a time when we tend to start getting, the older we get, the more you will notice that people will have age spots, and they'll have tiny blood vessels that start appearing. You'll notice that the veins in your legs and your hands become more prominent. And you may see varicose veins, which seem to be more common in women, but they happen with all of us. We also notice that we may have hair that grows, these thick, coarse hairs that grow where we don't want them, for women on our chin, for men out their ears and their nose. And so you have hair changes like that, but you also have generalized thinning of the hair on your arms, on your legs, and in the pubic regions. And then, of course, there's always the change in our shape and our agility, which is why I put this picture of this redwood picnic table that I put together this weekend. When I was young, in my 20s, when I was in my 20s, I wouldn't have been able to afford the redwood picnic table. So that's one of the advantages of aging. But the disadvantage is, when I was in my 20s, that would have taken me maybe a day to put together. And I would have found it easy, and the requirement that says, it takes 2 people, I would have said, sure. And maybe I might have needed a second person for a short period of time, but not for most of it. And so this big crate arrives that weighs 700 pounds, and I'm like, how can a table weigh 700 pounds? Well, most of it was the crate. But the table itself is probably a good 300 pounds. And when my husband and I were trying to pull this 300-pound monstrosity out of the crate so that we could put it together, we realized that he and I together were having difficulty doing what he could have done alone when he was in his 20s, and often did. And then we get it out, and he says, how do we think we're going to get it from the garage to the backyard? And the beauty was, as I pointed out to him, it is round. We will roll it, which is exactly what we did. Younger people would have gone ahead and put it together in the garage where it was easy and just carried it around to the backyard and not thought anything of that. So as you age, the point of this story was, as you age, you tend to put on fat in your abdomen, in your upper arms, in your buttocks, as well as around your chin. So you see the people with saggy chins, that is partly a loss of your collagen, but it also fat deposits underneath the chin that causes that kind of droopy, saggy chin you see in people as we age, as well as the droopiness under the arms and the fat in the abdomen that seems to be there no matter how little people eat or how much exercise they get. And it isn't just the change that occurs with how much you can lift and your agility. So you're losing muscle mass. You're also losing flexibility. And this, of course, gets worse as we get older because our muscles get weak. Our joints lose some of their flexibility. We may get stiff, and bending is harder. And of course, you see people who start to develop arthritis, which then causes some pain with movement. Then, of course, there are changes to our vision and our hearing, which isn't all bad news. Our peripheral vision narrows as we get older, which essentially means that part of our vision is impacted more quickly than the vision of what we see right in front of us, which is one of the reasons a lot of people have concerns about people who are older driving, is because they start losing that peripheral vision. A lot of automobile accidents are avoided because we see the person out of the corner of our eye, as they say, that's doing something stupid or careless, and we prevent that accident because we see it. As you get older, you lose some of that peripheral vision. Now, on the bright side, you drive so slow that it tends to make up for some of that. But one of the other things, and the good news, is that your eye changes shapes as you get older. And so nearsightedness tends to increase for a period of time, and then it stabilizes about midlife. So really around 40, your nearsightedness gets quite stable. And this occurs gradually. What we then notice is people are more farsighted than they were, which tends to get worse. And your book gave this example that kind of had me laughing, because it said, it's why you see young people with the newspaper right up to their face and older people just holding the newspaper further and further away. And I thought, well, that's a bad example now, because most of us read the newspaper online, on a computer, on a laptop, on an iPad, on the phone, and all we do is increase the size of the font so we can see it. We don't have to move it closer or further from our face. But the point is there. Farsightedness actually gets worse as you get older. And the other thing is that the lens of the eye changes, which means that brighter light is needed for people to see. And the other thing that then occurs with that is your eye doesn't change and adjust as quickly to light. So when it's dark out, you don't see as well. When you're driving a car and bright lights shine in your eyes, from those people that drive with their brights on, that annoy people, right? When that happens to an older person, it is harder for their eyes to adjust to that than it is for a younger person. And then there is our hearing. And everyone's hearing suffers from age. Everyone's. But it is rare that you have significant hearing loss before the age of 60. And while hearing does decrease, it decreases more for men than it does for women. That being said, men and women tend to have different hearing ranges most of their lives anyway. Women tend to be able to hear higher pitched sounds than men do. And we tend to have less hearing loss over time than men do. But everyone has hearing loss with time. And like all other activities, of course, there are things that you can do that make that hearing loss much worse. Repeated and long exposure to loud sounds. And that will make you lose your hearing faster. And people talk about loud music, but you don't tend to listen to loud music all day as you get older. But there are a lot of work-related things we call noise pollution that you hear that are just constant. And those things can have a significant impact on hearing. So when you are a nurse, one of the things you ask your patients about in their history is their occupation. And occupation can tell you a lot about a person's exposure to loud sounds. There is a lot to say about the sexual reproductive system with aging, and it changes significantly. Your book does a good job of outlining a lot of this, and I would suggest that you read it carefully. As much as young people think a lot about sex and probably don't like to think of people their parents' age thinking about the sexual system and the reproductive system, they do. That does not really change with age. One of the things that we know about sexual responsiveness is, like most things, with age it slows down. This is often made up for the fact that as people age, they tend to become more comfortable with their bodies. They know what they like and what they don't like, and they are more likely to have a stable partner that they've been with a long time, and they know each other well. Consequently, when you talk to older people about how happy they are with their sex lives and with sexual relations, it doesn't change much over time. It changes a little, and people become a little less happy with it as they age but for the most part, they don't. They are fairly content with their sexual lives. And what we found is that while sexual activity decreases, sexual satisfaction generally does not. We also know that one of the things that we think about is pregnancy, and historically most people, most women, had their children young. So they had them in early adulthood. And currently, people are starting to delay when they choose to start a family and when they choose to become pregnant. We know that we now have medications, we have contraceptives that are extremely effective and allow people to delay pregnancy in a manner that is cost effective to them. But we also know that with the delay in pregnancy and when people choose to become pregnant, that there are also a growing number of people that have fertility issues. and and fertility issues obviously rise for both men and women with age. Most of the babies in the United States are born to mothers between the ages of 23 and 33, and about 3% to women over 40. But those trends really have changed in the last couple of decades. So there are two primary forms of infertility. The infertility related to women who, for multiple reasons, either don't ovulate, have early menopause, or can't maintain a pregnancy. And then there are men who have low sperm counts. And there are things in men that can actually make low sperm counts and low motility worse. And a lot of those are alcohol, drugs of any kind, saunas, being out of shape, and so forth. For women, some of the things that can impede fertility are things like pelvic inflammatory disease. Now, some of these things are surgically correctable. But we do now have fairly effective fertility treatments that people can choose to use, and it's called assisted reproductive technology, and those have increased over the years from in vitro fertilization. One of the things that I would say is that there are also people who choose for various reasons to basically harvest their eggs. Some women, because when they're young, they do not want to have children yet, and yet they know that in vitro fertilization is far more effective when you have a woman who has young eggs. So they will take those eggs young, when a person is young, and they can freeze them. The other reason people sometimes freeze eggs is if they are about to go through cancer treatment. Then they may choose to freeze their eggs so that they will have them later. As people age, women go through menopause, and this usually happens around age 50, although there is a wide range of when this happens. And what you will see is hormonal changes. The hormonal changes can result in physical symptoms as well as emotional symptoms, but the big things people talk about are feeling hot, night sweats, and some psychological symptoms of irritability. There is hormone replacement to treat menopause in women, and there is a mixed story on hormone replacement. Certainly it is true that hormone replacement relieves the symptoms of menopause. And it is thought that it has other positive impacts, such as delaying osteoporosis. However, it has negative effects on cardiac wellness and can increase your risk of cardiac disease. And in addition to that, it also is known to increase the risk of certain types of cancer. And then finally, andropause. And this is the male, technically, I guess, the male equivalent of menopause, although it is really not the same thing, because it's kind of, as your book says, misleading, because it implies that there's the same sudden drop in male hormones that there are in female hormones with menopause, and that's just not true. The testosterone level in men does decrease with age, but it is a very slow process. and certainly does not have the same impact. Usually men are most concerned about it when they find a change in their sexual desire, and that can bother some men. When I got to this point on habits, I thought about writing this all out for you, and then I thought, well, if you haven't memorized this by this point in the semester, you're not going to. But this does not change much with age, except for the medications. Exercise, you need 150 minutes of moderate or 75 minutes of intense exercise per week, and you need to maintain that throughout your life. The good news about medications is that they get better all the time, and medications help us to maintain healthier, longer lives. Hypertensive medications are life-saving to many people, as is insulin. Now, of course, we know one of the problems with medication is the cost of them, but there are also there are over-the-counter drugs that a lot of people take, so aspirin and Tylenol and Motrin. And many of these medications, these drugs, are very helpful to us in the sense that they make us feel better and they relieve pain. But many of them, if taken incorrectly, can be wrong. And then, of course, there are drugs that can be abused. And the one that we know most clearly right now are opioids. Most people that get addicted to them started taking them because they were prescribed to them because they had pain or something had happened, and then they just didn't ever quit taking them because they became addicted. So opioids are wonderful for people that have pain, but you have to use them with caution because they can have very negative impacts. Tobacco's simple. Don't do it. It is bad for your health. It is bad for your health, and it is bad for your health. And it is dose dependent. The more you smoke, the worse it is for your health. But there is nothing good about taking anything into your lungs that should not be there. And that doesn't mean just tobacco. There are other things that people choose to do, like vaping and marijuana, that are also bad for your lungs. So the only thing that really belongs in your lungs is fresh air. Alcohol. We know that many people drink, probably the majority of people drink, but how alcohol impacts your body is dose dependent. So there is an amount that is not harmful to you, and in some cases may be helpful, but in excess it can be quite harmful to you. So alcohol is one of the things that people have to be careful about. And nutrition and obesity have been discussed in every chapter, and they are the same. A well-balanced, nutritious diet that's low in fat and low in red meat will give you a healthier, longer life. It will help you with your body weight. It will help you to reduce the risk of obesity. And we know that obesity is problematic. Now, don't misunderstand. Being too thin is as harmful as being obese. But what you want to do is maintain a healthy body weight. And that generally requires good nutrition and adequate exercise. And finally, let me close by talking to you a little about the impact of income and health. One of the great advantages in life is having a high income or being in a high socioeconomic status. The people with the higher incomes have better health, and there are probably many reasons for this. Better access to health care, better access to preventable care, higher educational levels, more likely to have access to healthy fruits and vegetables that are fresh, and 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 all around general access to things like places to walk and places to exercise. People with higher SES levels live longer lives than the people with the lowest levels. So if you compare the highest SES levels to the lowest SES levels, there is about a 30-year difference in life expectancy. So we should never pretend that income doesn't matter and that all people are equal. People born into poverty are disadvantaged in their health and in their life expectancy due to no fault of their own. This is something that we need to be aware of as nurses and as healthcare professionals, and we need to work to address. Again, as always, I have office hours each week. They are open to everyone. I hope you will come by and we can discuss this in more detail.